Hello students, welcome to today's class. I am Bernisha, lecturer from Emmanuel College of Pharmacy. Today we are going to discuss about an important and new topic from pharmaceutic subject, that is suppositories. These suppositories, which are the important dosage form which is used in the pharmaceutical practice. In this presentations, I will cover definition, advantages, disadvantages, their types, along with the basis which is used in the formulation of suppositories. Let's begin with the introduction. First, let's see what the suppositories. The suppositories are the semi-solid dosage form in which these medicaments for insertion into the body orifices other than the mouth. Usually, the suppositories are the semi-solid dosage form. We have already learned about the solid dosage forms and liquid dosage forms. Now it's semi-solid dosage form. In this, the medicament is inserted into the body orifices. Body orifices is nothing but the body cavities such as ears, nose, vagina, rectum, like that, which is other than that of the mouth. Usually, the suppositories are used rectally, vaginally, and occasionally urethral. There are various sizes and shapes for the formulation of suppositories, which is used for the insertion into the certain body cavities. Because our body cavities are different in shapes and size, so there are different shapes and weights of suppositories which is used rectally, vaginally, and occasionally urethral. Next is advantages of suppositories. First is bypass first pass metabolisms. So in first pass metabolisms, the drugs which we taken orally, they enters into the liver for metabolisms. They are metabolized and excreted through urine or fecus, like that. But when we are taking it in suppositories, it avoids the liver metabolism, so that it easily the drugs get absorbed in the rectum. If in rectum or vaginally, when we are taking the drug, it easily gets absorbed but it avoids the liver metabolism, so that the bioavailability of the drugs gets increases other than the drugs which we taken orally. Next is, which is useful in vomiting and unconscious patients when the oral route is not possible, because some of the drugs may causes nausea or vomiting, or the patients, they are suffering in coma conditions. We need to give them the suppositories, which is very useful for them to get the proper dosage forms. Next is local and systemic actions. As the suppositories can be used in the particular position or particular part, so it can use easily the local effect and also for the systemic effect. For examples, in the local effect, we are in the hemorrhoids conditions and constipation, we are using usually the rectal suppositories, and for also the systemic effect, we are using certain antipyretics. Then the reduced gastric irritations. Usually, some of the oral drugs like capsules and tablets may produce the gastric irritations, or some of the irritation in the stomach and gastrointestinal tract. But these suppositories which avoids this gastric irritations, or it is not are these drugs which does not produces any gastric side effects. Next is, it is better for the pediatric and geriatric patients. Usually, when the actually the suppositories we won't take it orally, so that the drugs which has the nauseous and bitter taste can be easily formulated into suppositories, and it can be easily administered by the children and the elderly patients who cannot swallow the tablets, who have their problems in who have the problems such as dysphagia conditions, so that the patients which have the problems in swallowing the tablets can easily take this suppositories. Next is avoids drug degradation in GI tract. So mainly certain drugs maybe have the problems, or they have sensitive towards the pH and enzymes present in the gastrointestinal tract. So that type of drugs can be easily formulated into suppositories. So these are the certain advantages of suppositories. First, it may bypasses the first pass metabolism. Next, it can be useful for giving in patients with vomiting and unconscious conditions, and it also produces local and systemic actions. It reduces the gastric irritations, and it is better for the pediatric and geriatric patients. Next, it can avoid the drug degradation in the gastrointestinal tract. Next is disadvantages of suppositories. Disadvantages shows poor patient acceptance. So that many of the people may feel some of discomfort and embarrassment, as some of the drug suppositories may usually directly enters inserted into the rectum or vagina part. So some of the patients may feel discomfort or embarrassment, and less compliance compared to oral dosage form. Some of the patients may very comfortable with the oral dosage form, so they may feel some less compliance with that of the oral dosage forms. Next is variable absorptions. So there may be the differences in the absorptions because due to the certain rectal contents, blood flow variations, the placement of suppositories. These are the certain problems which faced during the absorption irregularity. Next is leakage and messiness. Some of the suppositories may causes leakages and inconvenience while they are placed in the rectum. So it may melt before it reaches the certain temperature. It gets melt and leaks from the rectum. So it may cause some of the inconvenience and discomfort to the patients. Next, it is limited drug dose. So only the small quantities of drugs only can be incorporated into suppositories. So there will be some limited drug dose. Next is irritation of rectal mucosa. Though it does not produces any gastric irritation, sometimes it may produces the rectal mucosa irritations and causes inflammations. So these are the some of the disadvantages of suppositories, mainly poor patient acceptance, variable in absorption conditions, leakages and messiness, limited drug dose, and irritation of rectal mucosa. The sixth one is storage issues. Some of usually we have to store the suppositories at a certain temperature because it may melt at the body temperature. So in the high temperature, the suppositories may easily melt. So it requires some cool storage conditions. Next is insertion difficulties. There may be it needs some skillful technique. Skillful physicians for the insertion of suppositories, so it needs some of the skills for the doctors. So improper insertion may leads to expulsions or reduced efficacies. Next, the types of suppositories. The types means we already know that suppositories are used to inserted into the certain body orifices or body cavities. So based on the place where it gets inserted, it is classified into rectal suppositories, vaginal suppositories, urethral suppositories, nasal suppositories, and ear cones. Based on the position where it gets inserted, it gets classified into these 5 types. So first one is rectal suppositories. Within the name itself, we can identify that these are the rectal suppositories which is inserted into the rectum for the systemic and local action. Rectums are the part of the large intestine. So in these, the suppositories are directly inserted into the rectum. Usually it is taken for the relieving of constipation problems. In the picture itself, we can find that these are the rectal suppositories which is in this the shape of torpedo shape. This shape is known as torpedo shapes. Usually the adults will take about 2 grams of drugs, or the suppositories weight for 2 grams only taken by the adults. When for the children, we have to give only about the drugs weights. Suppositories weight about 1 gram. So mainly we have already studied in the disadvantages. Only small amount of drugs can be incorporated into suppositories because the adults can take up to the suppositories with the actual weight with the base. They can only take about 2 gram, and the children they can take only about the 1 gram. So mainly the rectal suppositories uses the bases such as cocoa butter for the preparation of rectal suppositories. So rectal suppositories are inserted into the rectum for the systemic and local actions. And the image shows the rectal suppositories. Next is urethral suppositories. These urethral suppositories mean for the insertion into the urethra. So it is very thin, long and cylindrical at one end and into the facilitate insertions. So we know that the urethral tract is very long, but and it is very certain cylindrical in shape. So the urethral suppositories are formulated into thin, long, and cylindrical at one end, and which is easy for the insertion into the urethral tract. It's generally the weight suppositories weighs about 2 to 4 gram, but these urethral suppositories are rarely used suppositories. So in this picture we can see that urethral suppositories, with the help of that injectors we will inject the urethral suppositories, which is very thin, long, and cylindrical at one end, which is easy for the insertion into the urethral tract. So first slide we can see about the rectal and urethral suppositories. Next is nasal suppositories. Nasal suppositories means these are the suppositories which is meant for the insertion into the nasal cavity, which is we can use it in the nose. So it is also very thin, cylindrical in shape. They are always prepared using the glycerol gelatin base, which is a water soluble base. They are about 9 to 10 centimeter long and weighs about 1 gram. In this picture we can see that a long thin cylindrical in shape which is inserted into the nose, and it's about 9 to 10 centimeter long and weight about 1 gram. The suppositories weighs about 1 gram. Usually these are used to treat rhinitis, sinusitis problems, and which produces onset of actions as it is directly inserted into the nostrils. So these are the nasal suppositories which are inserted into the nasal cavity. Next is ear cones. Ear cones is nothing but it is made for the introduction into the ear, mainly for the infection problems. Infections we are using this ear cones. These are the long thin cylindrical. These are also long thin cylindrical in shape. This weight about 1 gram. Usually in this picture we can see that ear cones which is about um, which is about a long thin cylindrical in shape, which is directly used in the ears, so that it can be easily, mainly it is used for the infection problems. Ear infections can be easily treated using this ear cones. It can produces onset of actions as it is directly inserted into the ears. So these are the 5 types of suppositories. First is rectal suppositories, urethral suppositories, nasal cones, and nasal suppositories, ear cones, and another one is vaginal suppositories, which is also known as pessaries, which is directly inserted into the vagina. Next is newer concept of suppositories. In nowadays, there are some of the new concepts for the suppositories. We are manufacturing the new types of suppositories. First one is tablet suppositories. First is this type of tablets are prepared by compression like tablets. These suppositories are compressed in like tablets, and it is used for the rectal and vaginal purpose. Mainly this tablet suppositories is used for the rectal and vaginal purpose, and it is mainly the vaginal suppositories are also known as pessaries. Usually it is almond like shapes, and mainly it uses polyethylene glycol as bases. And next is layered suppositories. The layered suppositories contains different types of layers, um, so that incompatibility of the drugs can be easily separated from each other. So some of the drugs may have some problems in mixing with each other. So these type of drugs can be easily formulated into layer suppository, so that the incompatibility of the drugs can be easily separated from each other. So the next is and also the drugs which have the different melting points can also be incorporated into the layer suppository, so that we can easily control the absorption rate. The first is tablet suppositories. The next one is layered suppositories. Next is coated suppositories. In this coated suppositories, they mainly uses the bases as polyethylene glycol and acetyl alcohol. These materials mainly controls their disintegration rate. Mainly it controls the disintegration rate to impart the lubricant properties. So lubricant means nothing but the greasiness, so that we can easily insert the vagina, we easily insert into the vagina, rectum, and other body cavities. And it also provides some of the protective action during the storage. So these are the coated suppositories. It is mainly coated with polyethylene glycol and cetyl alcohol. And the next one is capsule suppositories. The capsule suppositories mainly of different shapes and size, which is prepared filled with liquid semi-solids and solids, and which is mainly used for increasing the popularity. So first they have prepared the tablet suppositories, followed by that they have prepared this capsule suppositories. Usually inside the capsule they may contains liquids, semi-solids and solid drugs. So in coated suppositories, they may be fully coated with polyethylene glycol and cetyl alcohol. And in capsule suppositories, mainly it is formulated as capsule, and inside the capsule we can fill all the liquid drugs, semi-solid drugs as well as the solid drugs. So these are the certain types of suppositories. First is mainly we are using the 5 types of suppositories, and these 4 are the newer concept of suppositories. They are tablet suppositories, layer suppositories, coated suppositories, and um, another type of suppositories. Now for the formulation we have uses both the bases as well as the drugs. Usually the suppositories has mainly has the suppository bases along with the drugs. By mixing these two we can formulate the suppositories. So selecting the bases is very important in the manufacturing of suppositories. So the suppository basis has some ideal properties. Based on that ideal properties only, we can easily select the suppository basis for the formulation of suppositories. So first one, it must retain the shape and size on the storage. So the base we are taking for the preparation of suppositories. We have already known that the suppositories are prepared in different shapes. So it must retain the shapes till its shelf life. So throughout the storage time, it must retain its shape and size. So and second one is it should melt at the body temperature after insertion. So the base which should be melt at the body temperature when we are inserting the suppositories into the body cavities, it must melt at the body temperature. It should not melt at the melt at outside, or else it should melt at only at the body temperature. And the next one is it should be non-irritant. It should not irritate, whether it should not irritate the rectal mucosa, or while we are taking in nasally, it should not irritate the particular areas, and it should shrink sufficiently to remove from the mold. When we are taken out from the mold or demolded it from the mold, it should shrink out and sufficiently get properly removed from the mold, and it should not stick on the molds. And the next one, it should not interfere in release or absorption of drug. So it should be inert, and it should not interact with the drug, or else it should not interfere the release and absorption of drug. So that the bases which should be selected for the preparation of suppositories should be inert, and it should not interact with the what with the drug which is present in the formulation of suppositories. Next, it should permit incorporation of drug. The base which we are taken for the formulation of suppositories should permit the full incorporation, or it should fully mixed with that of the drug, and it should be compatible with the variety of drugs, not only a single drug. It should have the property of fully compatibility, or it should have the property that it should easily mixed with or incorporated with the other drugs, and it should be physically stable on storage. We have already studied that it should retain the shape and size on storage. Likewise, it should physically stable on the storage condition, and it should not be softened or hardened on storage. While the preparation formulation, we can know that this should be its hardness and this should be softness. So during the storage time, the bases should not soften or harden during the storage time. So these are some of the ideal properties which we should be implemented while selecting the suppository basis. First should be it should be maintained the shape and size during the storage. It should melt on a body temperature after insertion. It should be non-irritant. It should shrink sufficiently to remove from the mold, and it should not interfere in release or absorption of drug. It should permit incorporation of drug. It should be compatible with the variety of drugs. It should be physically stable on storage. It should not be softened or hardened on storage. Other than that, which also has some of the saponification value, iodine value, and acid soluble value. This which should also be meet the certain ideal values. Next one is types of bases. There are certain bases which is there are certain different types of bases which is used for the manufacturing of suppositories. Mainly, it is of three types. First one is oleaginous or fatty bases, and the second one is hydrophilic bases, and the third one is emulsifying or synthetic bases. So first one is fatty bases. Fatty bases means it is mainly in normally we can easily find it. The bases are maybe the drugs we are used to for the incorporation in the bases may be lipid soluble and also water soluble. So the bases which should be selected for the fatty bases if the drugs are lipid soluble. So main commonly used to oleaginous bases are cocoa butter, emulsified theobromo oil, hydrogenated oils. These are certain fatty bases which is used for the drugs which should be dissolved or incorporated in the fatty lipophilic phases. The next one is hydrophilic bases. That means which is water soluble and water miscible. So certain drugs which are soluble in the water. So certain bases like glycerogelatin bases, soap glycerin bases, polyethylene glycol. These are certain hydrophilic bases which is used for the drugs which gets easily dissolved in the waters. Next is emulsifying and synthetic bases. These are certain commonly used synthetic bases. They are bitipsol, masa, esteranum, and masopol. So these are the three types of bases. One is fatty bases, next one is hydrophilic bases, and the next one is emulsifying or synthetic bases. First, we are going to see about the fatty bases. In that, first we are going to see about the cocoa butter. It is also known as theobroma oil. It is mainly obtained from the roasted seed of theobroma coca. So mainly while roasting the seeds of the cocoa seeds, we will get this cocoa butter. Mainly the properties of this cocoa butters are at room temperature. It is yellowish and white solid having faint agreeable chocolate like odor. We have already known that the choco butter which is used in the manufacturing of chocolates. It is at room temperature. When we are seeing this basis, it is yellowish in color, and sometimes it may be of white solid with faint chocolate odor. Chemically, when it is when we are seeing the properties in chemically, it is a triglycerides. So it contains the glycerides and one or different fatty acids. It's a combination of glycerin and the fatty acids. It is mainly it contains oleopalmitostyrene and oleodistyrene. Mainly, it is the combination of oleopalmitostyrene and oleodistyrene. Mainly this cocoa butter is melts at the 30 to 35 degrees Celsius. We know that within the body temperature the bases gets melt. So the melting point of the cocoa butter or theobroma oil is at 30 to 35 degrees Celsius. The main advantages of using this cocoa butter is it melts just below the body temperature. So it get easily body temp within the body temperature it gets melted, and maintaining its solidity at usual room temperature. I have already studied in the properties. It is a white solid, so it maintains its solidity even it's the usual room temperature, and it can readily liquefy on heating and solidify on cooling. When we are heating it, it can easily liquefy, and on cooling we can easily get solid. On cooling it gets solidified. And the disadvantages, it also has some limitations. What means it exhibits marketed polymorphism and rancidity. Rancidity means in the last video itself I said that it is destroying the or reduction in the quality of the oils. So there may be the changes in the color, odor, taste in the fatty bases. Stick to the mold. Sometimes these cocoa butter may stick to the molds we are used in the formulation of suppositories. And the next is it may sometimes it gets leakages from the body cavities, and this cocoa butter is really very costly. So these are some of the properties, and it is used for the mainly used for the preparation of fat soluble drugs, which is used in the preparation of suppositories. Next one is emulsified theobroma oil. First, we have studied only about the theobroma oil. Next, in this emulsified theobroma oil, when we are using the large volume of aqueous solutions, then we have to use this emulsified theobroma oils. So, when we are using the large quantities of aqueous solution, we have to use this emulsified theobroma oil. So it is the combination. We have already studied that the combination of cocoa butter or theobroma oil is oleopalmitostyrene and oleodistyrene. Like that, this emulsified theobroma oil has the combination of glyceryl monostearate 5%, lenitive wax 10%, cetyl alcohol 2 to 3%, B-wax 4%, and it is usually these are the things which is incorporated or combined to form the emulsified theobroma oils. So it is mainly used when large quantities of aqueous solutions are incorporated. And the next one is hydrogenated oils. Hydrogenated oils means these are the types of oils in which orchis oils, cottonseed oil, coconut oil, and palm oils. When these oils may undergo hydrogenation process, they are known as hydrogenated oils. They are used as the substitute for the theobroma oils because we have already know that the theobroma oil is very costly, and it also has some of the disadvantages like it may sink into the mold. So it is the hydrogenated oils are used as the substitution for this theobroma oils. Mainly why we are using this hydrogenated oils means they are resistant to oxidation. Usually they are resistant to oxidation, and the lubrication of mold is not necessary. The hydrogenated oils itself act as the has the lubrication properties, so the lubrication of the mold is not necessary, and it is colorless and odorless. Suppositories can also be prepared using the hydrogenated oils because the theobroma oil has the slight chocolate flavors or chocolate smells, but when we are used to prepare a colorless and odorless suppositories, these hydrogenated oils can be used. So these are the really good substitution for the theobroma oil. So these are the three types of fatty bases. One is theobroma oil, next one is emulsified theobroma oils, and the next one is hydrogenated oils. Next is water soluble and water miscible bases. They are also known as hydrophilic bases. Usually these hydrophilic bases are used when the drugs which should be easily soluble in the water. So the drugs which get easily miscible in the water should be incorporated or formulated with the help of this hydrophilic bases. So first is glycerogelatin bases. Glycerogelatin basis means this basis is a mixture of glycerin and water. Usually it is the mixture of glycerin and water which is made stiff by the addition of gelatin. When we are taking the mixture of glycerin and water, it may be somewhat flowy in nature. So in order to make it as a stiff base, we have to add some of the gelatin with that. Next, these suppositories can dissolve or disperse into the body fluids and also releases the drugs within the body fluids. It can easily releases the drugs while we are inserting it into the nasal cavities. Within the nasal mucosa, the bases gets dissolved and disperse it into the body fluids and releases the drugs. There are two types of gelatin we are used in the preparation of glycerogelatin bases. One is type A gelatin and type B gelatin. There are certain disadvantages in the using of glycerogelatin bases. They may include some, mm, they may be hygroscopic so that it can easily absorb the moisture. So while moisture which can easily absorb the moisture and becomes a clump like structure. So clumps, so it is usually hygroscopic in nature. And the next one is bacterial growth, which is as it easily absorbs the moisture, it can be easily prone to this bacterial growth, and then it has some incompatibility. So when we are taking the tannic acid, ferric chloride and gallic acid, it may show some of the incompatibility with these drugs. So it may leads to some of the problems in the formulation of certain suppositories. And the next one is it may also produce some of the physiological actions such as laxatives. These glycerogelatin bases itself has the physiological actions such as laxative. We have already studied that the bases we are used in the formulation of suppositories should not produce us any physiological actions, though these are the certain bases which produces some physiological actions. These are the certain disadvantages of water soluble bases. Though it has some physiological actions, it can be commonly used for the preparation of suppositories. Next one is soap glycerin suppositories. Soap glycerin suppositories means in glycerin gelatin suppositories. First we have studied that glycerin gelatin suppositories. The gelatin is replaced with the sodium stearate or curd soap. Mainly that there is the only one difference between the glycerogelatin suppositories and soap glycerin suppositories. So in the soap glycerin they will replace the gelatin with the sodium stearate or curd soap. These also has the hygroscopic problems. It may also absorb the moisture, though it has this hygroscopic in nature. It is used for the preparation of suppositories. Polyethylene glycols. Polyethylene glycols are most commonly used for the preparation of suppositories. Mainly the water-soluble polymers are available from the molecular weight of 200 to 8,000. Up to the molecular weight of 200 to 8,000, we are using this water-soluble polymers. Next, it is available in different consistencies, mainly liquids, semi-solids, and solids. It is available in three consistencies which can be very easy for the formulation of suppositories. It also has some of the advantages. It shows it is chemically stable and it also non-irritant and it is free from bacterial growth and it is dissolved slowly in the body fluids and it is also free from sticking. It is the basic ideal properties which is needed for the sub bases. So it also provides they are chemically stable and it is non-irritant while taking in the body fluids. It is very non-irritant and it also free from the bacterial growth. It is free from the bacterial growth and it is dissolved slowly in the body fluids so that the drugs get dissolved so slowly in the body fluids so that it can dissolve slowly. And next one is free from sticking. Sticking means nothing but while we are taking this in the mold, it does not sticks on the molds. Next one is emulsifying bases. Emulsifying bases means these are the third type of bases which is used for the formulation of suppositories. In this, first we are using the Vitip-Sol. And these are the triglycerides of saturated vegetable fatty acids. Mainly, it is varying with percentage of partial esters. Usually, these are the triglycerides of vegetable fatty acids, and there are small amount of B waxes added as the hardening agent because as it is a vegetable fatty acids with the partial esters, it should have some hardening. It should need to be hardened with the adding of some hardening agents like B wax, and it should not be cooled rapidly because it may leads to brittle suppositories, because brittle suppositories means it may produces some of the like cracks while demolding the suppositories, when it should not be cooled rapidly. We should when we does not cool it properly, it may leads to the brittleness or crackiness. Next one is proper lubrication is necessary with the while formulation of suppositories. While using the synthetic bases, the mold must be lubricated properly, otherwise it may stick on to the molds, and it is very difficult for the demolding of suppositories from the molds. And next one is massa esteranium. Massa esteranium is nothing but it is the mixture of mono, di and triglycerides or saturated fatty acids, and it is having the formula of CH3COO2 CHCOOH, and it is a white, brittle, almost odorless and tasteless solid with melting point of 33.5 to 35.5 degrees Celsius. It is also melts at the body temperature below the body temperature around 33.5 to 35.5 degree Celsius. And the next one is masa pole. Masa pole is nothing but it consists of glyceryl esters, mainly lauric acid, and which is small amount of glyceryl monostearate has been added to improve its water absorbing capacity. So it is also the type of emulsifying bases which has glyceryl esters of mainly lauric acid, and in this we are using glyceryl monostearate for the for improving the water absorbing capacity. Next is factors affecting the selection of base. Now we see the different types of base which is used in the formulation of suppositories. There are some of the factors which affects the selection of bases. One is nature of drugs. We have already said that based on the nature of the drug only we will select the bases for the preparations. So the nature of the drug itself will fix the selection of bases. We should not select the bases like lipophilic bases for the water soluble drugs, and also the um, water soluble bases for the lipophilic drugs. So based on the drugs only we have to properly select the bases for the formulation purposes. Next one is route of administrations. Based on the route, which route we are inserting the suppositories, because some of the like cocoa butters may produce some of the leakaging problems, so we should not prepare it to the formulate it in the rectal suppositories. So like that, based on the route of administration itself we have to select the bases properly. The next one is based on the melting point of base. Some of the bases may we know that the bases should melt at the body temperature. Some of the bases should not melt at the body temperature, so they have to we have to select properly for the melting point of the bases. Next is drug release characteristics. We know that the drugs which is used for the formulations, like that some of the drugs should only released at certain bases. So based on that only we have to be based on the drug release characteristics only we have to select the bases. Next one is based on the patient comfort and also the climatic conditions. So these are some of the factors which affects the selection of bases. So with these factors only we have to select the bases properly. Next is displacement value. Displacement value is nothing but it is the amount of drug that displaces the base. This displacement value which plays a major role in the selection of base, as these displacement values helps in the accurate calculation of the base quantity. So it is also essential for the mold calibrations. So displacement value is very important for the selection of bases, and also it also helps to identify how much amount of base we have to select, or how much amount of base which has to be necessary for the formulation of these suppositories. this displacement value is the amount of drug, which shows the amount of drug which displaces the base. So within within that amount of drug, uh, before rejecting that amount of drug, the quantity which is remaining in that mold is we have to take in the base. So apart from that drug, we have to select the base. That basis is very necessary for the selection of amount of base. So first above we have known that factors affecting the selection of base. This displacement value is very helpful in known in the accurate calculation of base quantity. How much amount of quantity of base we have to select for the preparation of suppositories. Next one is the additives used to the bases. Additives is nothing but what are the along with the base we have to add some of the excipients which is very helpful in the formulation of suppositories. Mainly we are using the surfactants. Surfactants is nothing but it helps in the proper dissolution or enhances the dispersion of drugs within the bases. So it improves the drug release in the bases. So surfactants is mainly used in the dispersion of drugs within the bases. And the next one is preservatives. We know that the suppositories are taken directly into the body cavities. We have to check, we have to know that these suppositories are very sterile in nature. So we have to add a proper preservatives in order to prevent the microbial growth as well. So we are selecting this water soluble bases. So we have to add the proper preservatives to it. And the next one is antioxidants. Antioxidants is nothing but it prevents the oxidation process that occurs within the suppository bases. So that while prevents this oxidation, we can easily prevent the rancidity of the bases. And the next one is stiffening agent. Stiffening agent, like in the classification of bases itself, we have studied that some of the gelatins are added to increases the hardness of the bases. Like that, the stiffening agent are added to adjust the hardness. Mainly this hardness of the bases can also be improved by using the stiffening agents. For example, gelatin. These are the certain additives which are used with the bases. First one is surfactants to improve the drug release, and the next one is preservatives. Preservatives are used to prevent the microbial growth. And the third one is antioxidants, which prevents the rancidity, thereby reducing the oxidation process within the bases. And the next one is stiffening agents. Stiffening agents are used to adjust the hardness of the bases. And the next one is storage conditions. We know that the suppository should melt at the body temperature. So the maintaining of the temperature is very important in the storage purposes. So these suppositories to store in a cool places, and it should be protect from heat and moisture. Some of the bases can absorb the moisture, so it should be protect from heat and moisture. While packing, it should be packed in a aluminum foil so that it can be easily we can prevent the suppositories from heat and moisture. And mainly we have to use the refrigeration for the storage of suppositories. So these are some of the storage conditions we have to take important in while storing that suppositories. So the suppositories are the some of semi-solid dosage forms which is directly inserted into the body cavities such as ears, nose, urethra, vagina, and the rectum. And the body cavities other than the mouth. These suppositories plays a major role in the patients who are suffering with nausea, vomiting, and in coma conditions. Okay students, in this video we have learned about what is suppositories and the types of suppositories along with the advantages and disadvantages. In the types of suppositories we have learned about rectal suppositories, urethral suppositories, Next, nasal bug is vaginal suppositories and ear combs. The vaginal suppositories are also known as the suppositories, which we will study in the next class. So, in based on the parts which we are inserting this suppositories, they are classified into mainly these five types. And nowadays, the newer concept of suppositories have evolved. Within the newer concept, we have prepared the tablet suppositories, capsule suppositories, layer suppositories, and coated suppositories. And next we are going next we have learned about the types of bases. Types of bases means which is used for the formulation of suppositories. Mainly the bases and the active drug is important for the formulation of suppositories. There are three types of bases we have completely learned in this video, mainly fatty bases, hydrophilic bases, and um, synthetic bases. So next we have learned about the storage conditions and the preservatives added along with the bases. Okay students, I hope we all have learned about the basics according to the suppositories along with the suppository bases. Let's see in the next class. Thank you.